Pulmonary ventilation is the subject of this screencast. You may find information on pulmonary ventilation in Chapter 13 of your textbook. This screencast was designed to help you achieve the following objectives. Explain the purpose of pulmonary ventilation. Explain Boyle's law. Describe how air moves in response to a pressure gradient. Explain the process of inhalation. Explain the process of exhalation. Define tidal volume and dead space volume. Define and calculate functional volume and alveolar ventilation rate. List the various factors that can affect pulmonary ventilation. In a previous screencast, we learned that respiration consisted of 5 processes: pulmonary ventilation, external gas exchange, gas transport, internal gas exchange, and at the cellular level, cellular respiration. Now, let's focus on the first of these processes, pulmonary ventilation, or simply breathing. What is the purpose of pulmonary ventilation? To answer this question, let's look at what's occurring in the alveoli of the lungs. Pulmonary capillaries returning from the right ventricle are high in carbon dioxide and low in oxygen. Carbon dioxide is unloading or diffusing out of the pulmonary capillaries into the alveoli, and oxygen is being loaded or diffusing from the alveoli into the blood of the pulmonary capillaries, both moving down their concentration gradients. In order to assure that oxygen is loaded and carbon dioxide is unloaded at the appropriate rate, there has to be sufficient gradients of the two gases between the air of the alveoli and the blood of the pulmonary capillaries. So the answer to what is the purpose of pulmonary ventilation is to continually refresh the air in the lungs to maintain the appropriate gradients between the air in the alveoli and the blood in the pulmonary capillaries. Breathing, or pulmonary ventilation, is a mechanical process that utilizes basic principles of physics. To understand pulmonary ventilation, you only need to understand the following: the relationship between volume and pressure, and that air moves down a pressure gradient from high pressure to low pressure. First, let's consider the relationship between volume and pressure. Boyle's law defines the relationship between volume and pressure, and it states that volume is inversely related to pressure. Okay, now translated to English, what does that mean? Well, a change in one leads to an equal but opposite change in the other. A change in volume leads to an equal and opposite change in pressure, or a change in pressure leads to an equal and opposite change in volume. Take, for example, the following. So I have a container of volume X, just some value X. And air inside that container is pressing on all sides of the container at pressure Y. Now let's say I take my hands and I smush that container down, right? I don't let any air escape, but I cut the volume of that container in half. So I go from a volume of X to a volume of 1/2 X. According to Boyle's law, what will happen to pressure? If you said pressure will now be 2Y, or twice what it originally was, you are correct. By cutting volume in half, I have doubled the pressure, according to Boyle's law. Now that you understand the relationship between volume and pressure, now let's look at how gas or air moves from an area of high pressure to an area of low pressure. And we're going to do that by looking at a device that we're all familiar with, and that is a vacuum cleaner. So a vacuum cleaner has a fan that's moved by an electric motor, and that fan moves air out an exhaust port. And as it moves air out the exhaust port, it creates an area of low pressure, or a vacuum within the vacuum cleaner. So the pressure inside the vacuum cleaner is lower than the pressure outside in the surrounding environment. And so air moves from a higher pressure to a low pressure, and in so doing moves dust and other particles with it, and that's how a vacuum cleaner sucks up particles like dirt and dust from your carpet. Again, it's using the principle of air moves from high pressure to low pressure. Now that we understand the relationship between volume and pressure, and that air moves from high pressure to low pressure, we are now ready to look at the mechanics of pulmonary ventilation. In the image on the left, the lung is at what's called the transition point. This is the lung after exhalation and right before inhalation. There is no contraction of any of the muscles involved in breathing. Now take a deep breath and observe the changes that occur in your torso, in particular your chest. Go ahead, take a deep breath and observe what happened to your chest. The image on your right shows the changes that occur in the thoracic cavity during inhalation. Scalene muscles, which are attached to the skull and the ribs, contract and elevate the ribs. During deep inspirations, such as during exercise, strenuous exercise, the sternocleidomastoid muscle also elevates the ribs. External intercostal muscles lying between the ribs contract and raise and expand the chest. The diaphragm contracts, and as it contracts, it flattens and pushes the abdominal contents downward. With the elevation and outward movement of the ribs and the flattening of the diaphragm, the volume of the thoracic cavity increases. The lungs are attached to the thoracic cavity by the pleural membranes, so as the thoracic cage expands and the volume increases, the intrapulmonary volume of the lungs increases as well. As the volume increases, there is a decrease in intrapulmonary pressure, or the pressure within the lungs. With the intrapulmonary pressure now lower than atmospheric pressure, air moves from high pressure to low pressure and into the lungs. At the end of inhalation, all of those inspiratory muscles relax, and the elastic tissue of the lungs cause them to recoil and bring the thorax back to its original dimensions at the transition point. The abdominal contents also recoil and push the diaphragm upward. This decreases the size of the thoracic cavity and increases the pressure, the intrapulmonary pressure in the thoracic cavity. With the depression of the ribs and the superior movement of the diaphragm, intrapulmonary volume decreases, which causes an increase in intrapulmonary pressure. With the pressure of air in the lungs now greater than atmospheric pressure, air now moves out of the lungs during exhalation. The sequence of events that I have just described make up a respiratory cycle, starting at the transition point and then actively inhaling, followed by a passive exhalation where the inspiratory muscles simply relax and the elastic tissues of the lungs and the abdominal contents recoil, and no energy is involved in exhalation. Quiet breathing of this nature is called eupnea. It should be the kind of breathing that you're doing right now. Exhalation can be active, however. If you are blowing up a balloon, if you're doing heavy exercise, if you're coughing, laughing, or sneezing, exhalation can become active. During active exhalation, intercostal Internal intercostal muscles contract and pull the rib cage downward and inward. Also, the abdominal muscles contract and push the abdominal contents upward, pushing the diaphragm upward. Active exhalation is also involved in compensating for respiratory diseases, such as someone is gasping for air because they have asthma or emphysema or some other respiratory ailment. The rate and depth of breathing can have a large impact on the effectiveness of ventilation. Tidal volume is the amount of air that's moved into and out of the respiratory tract with each breath. Some of this air, however, never makes it to the respiratory zone. It remains in the conducting zone. It remains in your nasal cavity, your trachea, your pharynx, your larynx, even your terminal bronchioles. This is called the dead space volume. The functional volume is the air that actually makes it to the respiratory zone and therefore is available to participate in gas exchange. Since the dead space volume is constant, it doesn't change, if you take deeper breaths, you increase the functional volume. For example, typical tidal volume is 500 milliliters, and the dead space volume, let's say, is 150 milliliters. That leaves a functional volume of 350 milliliters. That's how much air is actually available to participate in gas exchange in the alveoli of the lungs. Now, let's say you take a deeper breath. Say you take in a tidal volume of 600 milliliters. The dead space volume remains 150 milliliters, so you have increased your functional volume to 450 milliliters. And obviously, if you, in addition to increasing your tidal volume, also increase your breathing rate, you're going to significantly increase the amount of fresh air that's available to participate in gas exchange in the respiratory zone. If we know the functional volume, it allows us to calculate the alveolar ventilation rate. And what is the alveolar ventilation rate? It is the amount of air that enters the lungs, inflates the alveoli, and is now available to participate in gas exchange across the respiratory membrane. The alveolar ventilation rate is calculated by taking the functional volume and multiplying it by the respiration rate, or the number of breaths or respiratory cycles per minute. Let's assume for these examples that we have a respiration rate of 12, which would be typical for a man of 155 pounds. We're going to calculate the alveolar ventilation rate using the functional volumes from our previous two examples. If you recall, for example 1, we calculated a functional volume of 350 milliliters. If we take that functional volume and multiply it by 12 breaths per minute, we get an alveolar ventilation rate of 4,200 milliliters of air. That's the amount or volume of air that's available to participate in gas exchange across the respiratory membrane per minute for example 1. Now let's look at example 2. Here we have a functional volume of 450 milliliters. Using the same respiration rate of 12 cycles per minute, we have an alveolar ventilation rate of 5,400 milliliters per minute. Now let's talk about various factors that can affect ventilation. If there is any impairment to the muscles that are involved in inspiration or inhalation, this will reduce the amount of air that can enter the lungs. If there's damage to the inspiratory muscles, if there is partial or total paralysis, this will decrease the ability of the thoracic cavity to expand and therefore decrease the volume of air that enters the lungs during inspiration. A loss of compliance or the ability of the lungs to distend and increase in volume during inspiration can also reduce ventilation. Severe obesity reduces the ability of the chest to expand due to the fat that surrounds the thoracic cavity. Arthritis of the thoracic spine and the ribs can also reduce chest compliance. And in premature infants, they may lack the surfactant that's normally produced by the respiratory membrane, which reduces the compliance of the respiratory membrane, literally reduces the ability of the alveoli to expand. Loss of elastance affects ventilation in that it reduces the ability of the lungs to recoil and therefore reduces expiration or exhalation. In certain conditions, such as emphysema, you have fibrosis of the lungs where the normal elastic tissue of the lungs has been replaced by dense connective tissue or simply scar tissue. This tissue does not recoil like the normal elastic lung tissue does, and therefore there is a reduced ability to exhale. Airway resistance can also affect ventilation. Any obstructions in the respiratory tract can decrease ventilation. If foreign objects make their way into the trachea or the larynx or the bronchi or even the bronchioles, this can reduce the ability of air to pass into and out of the lungs. Mucus and other fluids, either introduced from outside of the body or produced within the body in response to allergens or infection, can reduce the ability of air to move to and from the lungs. And constriction of the bronchioles, which occurs sometimes during an allergic reaction or in a reaction such as asthma. Reduction in the size of the bronchioles, the lumen of the bronchioles specifically, reduces the ability of air to flow to and from the lungs, thus reducing ventilation. Now let's review the objectives of this screencast. Explain the purpose of pulmonary ventilation. Explain Boyle's law. Describe how air moves in response to a pressure gradient. Explain the process of inhalation. Explain the process of exhalation. Define tidal volume and dead space volume. Define and calculate functional volume and alveolar ventilation rate. Lastly, list the various factors that can affect pulmonary ventilation. The topic of the next screencast will be lung volumes and capacities.